I am Dr. Praveen Kumar, Professor in Gastroenterology from Vaidehi Institute of Medical Sciences and Malaya Hospital, Bangalore. Gastroesophageal reflux disease is a very common problem in our society. Most of us have this problem at some time or the other in our life, starting from school days till we die. Even the pediatric group of people, newly born, can also have a reflux disease which has to be diagnosed properly. When we say reflux, it is a simple mechanism where the acid which is supposed to be in the stomach passes in a retrograde way into the esophagus, producing various symptomatology. Common symptoms are burning sensation in the chest, belching, acid regurgitation in the form of sore eructations, constant throat irritation, and sometimes if it is severe, it can mimic a lung infection, it can mimic an ear infection, and patients keep going to various specialists other than gastroenterologists for their recurring ear problems, lung problems, and so on. Well, the reasons for a gastroesophageal reflux disease nowadays is hurry, worry, and curry. Most of us are in a hurry to do our day-to-day activities, stress of reaching the office, stress of reaching the school, stress of catching the bus, biometrics, punching the attendance card in time, hurry-burry, school, business and office schedule, irregular lunch hours, unscientific way of eating, coming late in the night, having a meal, speaking to family members, watching the TV, and lying down without any exercise. So the take-home message is to tackle gastroesophageal reflux disease, the grass root is hurry, worry, and curry. Well, in addition to the symptomatology which I mentioned to you, these symptoms can be more in patients who have other illness like diabetes, blood pressure, lung diseases, people who are overweight, obese, people who consume significant amount of alcohol, and not forgetting about smoking. There is a high incidence of gastroesophageal reflux disease in patients who consume alcohol and who are chronic heavy smokers. When we talk and discuss and treat gastroesophageal reflux diseases, we should not forget the neighboring organs like heart and lungs. There are many patients who have come to the gastroenterologist or a doctor at various levels. They have complained symptoms of gastroesophageal reflux disease, and on further investigation they are found to have a major heart problem, a major lung problem, or major abdominal problems like gallbladder stones. They can also mimic gastroesophageal reflux disease. But I would stress on one point that many times a serious heart disease, including a heart attack, what we call it as myocardial infarction, is missed. So one should be aware that in addition to a simple reflux which all of us have right from school days till our ripe age, there could be a serious underlying problem. It could even be a problem related to your ribs. It could be a problem related to your spines. So one has to look at the gastroesophageal reflux disease as a complete disease and rule out curable things which is related to the heart, lungs, spines, and the ribs. As far as investigations are concerned, there is no genuine method by which we can diagnose gastroesophageal reflux disease except going into a detailed history, starting from his day-to-day activities, his dietary history, his stress and strain, his relations with the family, his relation with the friends, the situation in the office, and all his personal habits like smoking and drinking. In my opinion, the investigations are slightly lower. Nothing like a good history, because 95% of the time the diagnosis of a gastroesophageal reflux disease can be done by taking a good history. Apart from that, well, we have to do certain investigations like endoscopy, which is a very simple procedure, which will tell us what is happening to the internal lining of the esophagus and the stomach. For example, esophagitis. Or if some patient has come with complications like bleeding, are we dealing with any kind of an ulcer there? Or if we are dealing with an ulcer, is it showing any changes which can be cancerous? So that's the advantage of doing endoscopy. But the take-home message again is, not all patients of gastroesophageal reflux disease require an endoscopic procedure. In addition to that, we also take the help of investigations like measurement of the pH, esophageal motility study in the form of manometry, and very rarely we do certain X-ray studies like barium meal. I once again stress, we also should do procedures like evaluation of the heart, evaluation of the lungs, and looking at the other abdominal organs like a simple ultrasound, which will give us a wealth of information as far as liver, gallbladder, pancreas, and kidneys are concerned, because these diseases can also produce symptoms which could mimic gastroesophageal reflux disease. Having spoken in brief about gastroesophageal reflux disease, what is the treatment? There is no special treatment required for gastroesophageal reflux disease. If you can remember what your parents told you, what your grandparents told you, and what your great-grandparents did when they were young. One is diet. Look into the diet. Diet should be easily digestible, simple. It should contain less oil, less masalas, less spices, fried items. Soon after food, one should not lie down. Preferably, there should be a gap of 1 to 2 hours after a dinner. And always remember, never listen to your tongue and fill your stomach. You listen to your stomach and then eat accordingly. Your stomach will never make a false statement to you. The moment you take something which is bad, which is going to produce reflux, your stomach will tell you, be careful. So always listen to your stomach. Avoid listening to your tongue, because 90% of the patients who come to gastroenterology consultation are all the slaves of the tongue. They don't listen to the stomach and they pay penalty in the form of various diseases, including gastroesophageal reflux disease. In other words, lifetime modification. Again, coming back to that statement, hurry, worry, and curry. As far as treatment is concerned, it is very simple. In addition to the lifetime modifications, lifestyle modifications, one can take age-old remedies like a soda or an Epsom salt or simple antacids, which can cure 50% of the gastroesophageal reflux diseases. We have various drugs in addition to antacids and lifestyle modifications. For example, H2 receptor antagonists, what we call as we used to give this in the initial stages, but the younger generation are slowly forgetting that. One should still stick to simple medications like H2 receptor antagonists, which include ranitidine, which is a very good drug, which reduces the acid, and in 50% of the time, this simple drug is good enough instead of going to high-end drugs like proton pump inhibitors. The gold standard for the treatment of gastroesophageal reflux disease is proton pump inhibitors? Well, in the market we have various proton pump inhibitors, esomeprazole, rabeprazole, omeprazole, famotidine and ranitidine, which were the H2 receptor antagonists. But if you have a genuine garden variety of gastroesophageal reflux disease, one should use proton pump inhibitors in a liberal way, and you should educate the patient when to take. It should be taken half an hour or 1 hour before food. It should not be crushed, and it should not be combined with preferably other drugs. Question is how long to take? Well, it should be taken under the supervision. It should not be over-the-counter drug, because long-term proton pump inhibitors have its own untoward and side effects, even producing cancer. Today, proton pump inhibitors are being used like food material. Every prescription in the hospital has a proton pump inhibitor. Over-the-counter drugs are proton pump inhibitors. Our advice and recommendation is be careful when you use a proton pump inhibitor. Do not misuse it. It is an excellent drug. In addition to that, it also can reduce bone reduction and other complications. One should be aware. And please do not use a proton pump inhibitor as an over-the-counter drug. Lastly, when all the methods, including the life modifications, drugs fail, then one can resort to surgical methods like laparoscopic repair of the gastroesophageal junction. There are various methodologies which I will not go into the details. Well, there is a definite role of surgery in gastroesophageal reflux disease, which has to be proved by a good workup. Not all patients of gastroesophageal reflux disease should be recommended for surgery, but definitely there is a role. So this is in brief about gastroesophageal reflux disease, and the take-home message is hurry, worry, curry, and do not miss major problems like a silent heart attack or what we call it as a myocardial infarction. Thank you.